Fantastic. Thank you so much for the introduction. I guess showing this image here, just a background to my research and also the Binex cluster is that the cluster comprises of mechanical engineers, biologists, material scientists, and clinicians and physicians. And the goal is really that we combine our skill sets, we combine our expertise, and we develop innovative therapies for improving patient care. And I hope that the next few slides will be an indication of how the interdisciplinary work in action. Right, here we go. But the topic is really focusing on ionizing radiation and microgravity today. So as we know, musculoskeletal atrophy due to space travel has serious implications for astronaut health, and particularly due to future planned missions to the lunar surface and to Mars. And I think it's generally well known that if you don't load bone or you don't load muscle, it results in quite catastrophic tissue loss. And particularly in the space environment, we also have the ionizing radiation that's also prevalent. And this is particularly damaging to bone as well as the unloading. And this is thought to be due to the high calcium content, and about 30 to 40% more radiation is absorbed by bone because of this and compared to other tissues. So this can make bone a very common site of radiation-induced damage. We see increased bone pain, decreased bone mineral density, increased osteoporosis, and then patients can increase their risk of fracture. And for those patients, for example, those who are following radiotherapy, it can be very difficult to repair that fracture just because the radiation has substantially caused damage to those cells and tissue function. What's really interesting more recently is that small animal models have shown that if you expose them to an environment of radiation combined with microgravity, then we see an accelerated and more detrimental loss in bone. So I guess this is a great example of the extreme environment of space, the unique environment of space, and how it can be quite detrimental to bone tissue. And then very broadly, there are three paths of damage. We have the unloading, the reduction in stress and strain. We see an increase in reactive oxygen species and oxidative stress. This leads to DNA damage. Another path of damage is indirect radiation damage, and this is basically the radiolysis of the water in the body. We get a burst release of ROS, leads to DNA damage. And the third method is the direct damage of radiation. So it directly ionizes the DNA, and that causes DNA damage. And this can affect many cells within the bone and leads to a cascade of a few processes that leads to a bone loss, bone atrophy, and a loss of strength as well. In terms of oxidative stress, the body has endogenous antioxidant system. We can also source it from our diet as well. In order to neutralize all of these free radicals that are generated, but that system is often overwhelmed. And at the moment, there's no therapeutic that's able to prevent either the unloading induced bone loss or the radiation induced bone loss for people on Earth or for these future planned missions to space. So we wanted to have a look to see if we could investigate and develop a new medical countermeasure that could reduce the damage caused by radiation and unloaded bone atrophy. And we looked at cerium oxide nanoparticles. And what's interesting and unique about the cerium oxide nanoparticles is that they are autocycling between a 3+ and 4+ oxidation state. And really interestingly, when it goes from 3+ to 4+, it mimics certain types of these endogenous antioxidants that we have in our body, and therefore it targets and neutralizes certain types of these free radicals. And then when it travels from 4+ to 3+, it's able to then mimic different types of antioxidants in our body and then target and neutralize other types of free radicals. So we wanted to see, number one, do the nanoparticles, through neutralizing these free radicals, they reduce this radiation damage? And then number two, if we tweak the synthesis of these nanoparticles and change the surface kinetics, can we find a formulation that is better at preventing this radiation loss compared to the other? So we had a look where there was more 4+ to 3+. And this particular formulation was shown to mimic glutathione peroxidase in the body, catalase in the body, and therefore it's targeting your really harmful hydrogen peroxide, your hydroxyl radicals, thought to be the most harmful free radical in the body. And then our second formulation had more 3+ to 4+. And interestingly, we were able then to tune these particles so that they now behave more like a superoxide dismutase. So then it's now targeting your superoxide anions instead. We did a lot of in vitro experiments using mesenchymal stem cells and macrophages. The results here are on the left-hand side and the right. I won't go through all of those. But what we found was that both formulations significantly reduced the ROS, they significantly reduced DNA damage, but we did a lot of other experiments as well. And it seemed as if the 3+ appears to be a superior formulation compared to the 4+ when we were looking at this. So we moved on with the 3+ and had a look in an animal model. We gave it intravenously. Here we have a nano-CT. This is trabecular bone in the top of the knee, top of the tibia. And we can see how the radiation has damaged. We've got a lot of bone loss. But those animals that were exposed to radiation and given the nanoparticles, we can see how the bone area has been maintained. But we also measured strength, and we found that the strength was maintained as well. Here we have, because it was given systemically, one of the problems when people are exposed to radiation is we can reduce our platelet count. So we have, so patients can have problems clotting blood, so they can have unwanted nosebleeds. We have problems with hemoglobin and red blood cells, so patients can get fatigued. White blood cell count drastically drops, so we're more exposed to infection. And as mentioned, at the moment, there's no effective countermeasure against this. But notably, in the yellow bars, those animals that were given the radiation plus the nanoparticles, we can see how we have a significant increase in many of these key cells that are within the bloodstream. We also looked at blood chemistry data. Here we have the radiation has increased bilirubin levels. It's decreased alkaline phosphatase levels, so it's suggesting liver damage. And again, when we look at the animals that had the nanoparticles, we see a reduction in that liver damage, that radiation-induced liver damage. So we did a lot more experiments as well, and we found overall that it significantly reduced the damage that's caused by radiation. So the next question was, what about unloading? What about the simulated microgravity and the bone loss that's associated with that? So we copied the NASA hind limb suspension. That's a very common model that's used to simulate microgravity. We suspended animals at 30 degrees over a 2-day period in order to induce this bone loss. And then just drawing your attention here, this is the hind limb suspension model. We can see this bright pink stain. And what that is those are cells that are actively resorbing bone. So they're activated and they're munching away and getting rid of the bone. We have a bit of adiposity as well and osteoporosis that's developed. But in those animals that receive the cerium oxide nanoparticles, you can see there's a lot less red stain. And so it's looking as if we will quantify this. The data is literally coming in as I speak. So we're going to quantify this. We're going to look at other parameters. But certainly initially, it's looking as if we've got a great positive effect in reducing this unloading as well. So the next question that we had was, of course, what happens if you combine simulated microgravity and radiation? So that case that's happening in space, that kind of the worst case where we get accelerated bone loss. And we did this with collaborators at the Johnson Space Center. We exposed, and we did this in vitro only at the moment with macrophages. We exposed them to simulated microgravity using rotating wall vessels. We exposed them to gamma irradiation. And we did a few experiments, and here I've shown the harmful levels of pro-inflammatory cytokines. We can see that in our group where they've exposed to both simulated microgravity and radiation, which really thrown up the amount of pro-inflammatory cytokine markers. But in those cells that were supplemented with the nanoparticles, we can see how it's significantly decreased. We also did some RNA sequencing, so we had about just under 33,000 genes that we looked at. And these are the most significantly down-regulated genes, the most significantly up-regulated genes. And we can see that the nanoparticles are really down-regulating genes associated with inflammation, osteoporosis, bone loss, while also up-regulating beneficial bone metabolism and also a pro-healing macrophage phenotype. There's other ones where we're not too sure what the genes is currently unknown. So it's looking as if, in that combined environment in space, these nanoparticles will be helpful or could be helpful. We also have had a look at a drug completely separate to the nanoparticles called P7C3. And this has been shown to boost metabolism. There's a lot of work done with neurodegenerative diseases, ALS, Parkinson's, Alzheimer's disease. And they've shown to be very effective. They can recover animals in many respects. And we wanted to have a look to see if this helped with bone, number one, and number two, does it help with ionizing radiation? And in a nutshell, again, I'll just point you to here. We have our control bone, damage caused by radiation. Those animals that received the P7C3, we can see how the bone area has been maintained and also the strength was maintained. And we have some other data here that supports that protective effect. Moving on to the hind limb suspension and loss through unloading. Is it effective? Well, here I'll just point you to these images here. This is healthy bone, damage caused by radiation, and then those animals given P7C3, and we can see how it's helped to protect against that. So we've also, and I'm not showing you, we've done a lot of safety analyses as well, looking at the nanoparticles. Are they safe? Are they toxic? The P7C3. And at the moment, both in the dish, in vitro, and in the animal, at the doses and the timing that we're using, we're not seeing any toxicity. We've also done a lot of experiments looking to see what the mechanism of how these drugs may be working. And it looks as if they're slightly different. They both have the same result, but the way they get there is slightly different. And then by combining them together, we seem like we may get a more potent effect. And that combined drug, combined nanoparticles with this P7C3 is this 64C73. That's our investigational product, and that just has been commissioned into the NIH's Radiation and Nuclear Countermeasures program, which means that now the NIH will be able to sponsor its further investigation towards use in people, contingent, of course, on the fact that it continues to do well and it shows no toxic side effects. So that's great. And so, as mentioned, again, there's no effective countermeasure for radiation injury, and we've kind of focused a little bit more on astronauts and deep space travel, but equally important to our military and civilians if they're exposed to a single dose of high radiation through an accident or through an intentional event, or oncology patients undergoing radiotherapy. And just looking at the market for radiation countermeasures, June 2034 it's anticipated to increase to just under 13 billion per year. And this is because of the increase in cancer prevalence, the increased threat of nuclear events, and also radiation in accidents as well. And then to thank Dr. Sidip Seal, a collaborator here with this project and a co-inventor of the nanoparticles, as well as his team, Craig and Raja. And a big thanks to Simon, who did all of the work I presented here today, as well as Chris, who worked over at the Johnson Space Center. And thank you for your time and for listening.